So this is 5 minutes later. Her right hip was adducted, and really all I did was lean into that leg in a direction in which I could create vertical force through the pelvis, and I could see her head bob up and down. Let's have you lie on your stomach now. And let's have your head up there. So visually, they look more symmetrical. I can now take up the slack. So you see that movement that comes to a stop point? That's called taking up the slack. And now I'm going to spring it, and I can see your head bob up and down. And now when I let go, there's a recoil. Now this is where that ligament is, the sacrotuberous ligament, and I can now indent that ligament a little bit. So we've changed the structure, and this is treatment for what is called a right downslip of the ilium. Do you want to come sit in this chair and see how you feel? And after that, we'll have you walk up and down the hall. Your thoughts? Hard to tell.
Yeah.
That's okay.
Yeah.
That's all right.
While I was lying on the table,
yeah,
and you were pushing on my right foot.
Yes.
I could feel the left side of my leg and some things relax. So that felt good.
Okay.
That makes sense. I don't know.
Very good. So you had less symptoms down the left leg.
It just felt like things relaxed.
Yeah, which is interesting in treating the right side. It affected both sides, apparently. So let's have you walk up and down the hall. Yeah. Your thoughts?
Things feel looser.
Uh-huh.
Looser.
Good.
Just.
I'll take it. Looser sounds good to me.
Easier to move.
Yeah, and over the next day you'll be able to test how you feel in longer term sitting, you know, and how you feel after going to bed and getting up in the morning and such. So the proof is in the pudding. We'll know in time. But I feel like we're off to a good start. I'm also going to teach you self-treatment for downslip. It doesn't tend to recur unless you have a similar injury. And I'm going to teach you how to keep your hips open by simply pointing your foot outward. So when you twisted to the right, your feet were pointed forward. You twisted your upper body to the right and your hips were locked. Now if you point your right foot out a little bit, okay, now when you twist to the right, you're twisting with your whole body. Your hip and your lower extremity is participating in that twist. So whenever you twist, open up the hip by pointing the foot outward. Isn't that different?
Yeah.
You're not going to end range of spinal movement. And you know, when your feet were pointed straight, your hip was locked. The next mobile joint was your sacroiliac joint.
So my hips were pointed straight.
They stayed pointed straightward.
It was a sudden movement.
Yes. Yes.
It wasn't a planned thing.
Yeah. Very good. So hopefully we can prevent it, and if not, you will know how to self-treat it. And I think you'll, you know, by doing the self-treatment over a few days, you'll just feel like you're in control, reinforcing the treatment, but I've not seen it return. So you have reason to be optimistic. Any final thoughts?
No, thank you. And it doesn't hurt. For
Good.
people like me, it doesn't hurt.
Yeah, it's very gentle.
That's the big...
The treatment is very gentle. I don't believe in large forces.
Didn't hurt at all.
Great. Thanks.